Hello there, welcome to Dr. Z's Health Education videos. My name is Dr. Zaidi, and I am an ophthalmologist. I'm actually a retina surgeon, which means after medical school I did training in ophthalmology, which is diseases and surgeries of the eyes, and then I did an additional training in retina surgery. And like many doctors, I find myself unable to spend an adequate amount of time with my patients teaching them about their disease and about what they can do about their disease. So what I've decided to do is to try to make some videos so that patients can watch these in the clinic or go home and watch them at home to educate themselves about various diseases. So today I'd like to provide an intro to the eye. After all, I am an eye doctor, and that is my area of expertise. So let's get started with looking at here a picture or diagram of the eyeball. So before we can understand diseases of the eye like macular degeneration or diabetic diseases of the eye or retinal detachments or cataracts, we really need to get an understanding of how the eye works. So if there is an object emitting light, that light is going to pass from this direction, go through the cornea, through the lens of the eye, and then form an image on the retina. So let me just see if I can point out some important structures of the eye. So here we have, and I'll write this out in bigger writing, but here we have the cornea. You may have heard of this. You may have heard of patients with corneal diseases or cornea transplants. Then we have here, circle in blue, the lens, and the cornea and the lens exist in the front of the eye, and the job of the cornea and the lens is to focus light, much like a lens of a camera, onto the retina. And when the lens becomes cloudy with age, we call that cataract. So you can imagine a patient with cataract, light isn't really getting through the eye and getting focused onto the retina, so the patient is going to have a blurry image. As the light keeps traveling its journey to the eye, it then hits the retina, and here we see these red and blue lines here which represent retinal blood vessels, and then the very center of the retina is called the macula. So the central portion of the retina is referred to as the macula. And you may have heard of things like macular degeneration, which are diseases that affect this part of the eye, the macula. And finally, the retina and the center of the retina, known as the macula, take that light, convert it into electrical signals, and those signals travel down the optic nerve to the brain. So let me label this structure as the optic nerve. The optic nerve is what leads directly to the brain, is actually an extension of the brain. So when your eye doctor looks into your eye, your optic nerve, they are indeed looking at a piece of your brain, so to speak. So as you might imagine, diseases of any part of this eye, whether it's the cornea in the front, the lens, or the retina, or the optic nerve, any damage to those structures can result in vision problems. In my next videos, I'm going to pick specific eye diseases and talk to you and educate you about them. One final word, and that is that this idea and the inspiration for these videos and the way I'm conducting these videos is inspired by Sal Khan from the Khan Academy, who has a great website called khanacademy.org, in which you can watch great videos and learn about math and chemistry and finance and all kinds of subjects. And I thought that this would be a great way for me to create videos to educate patients. So thank you, and see you in the next video.